Now, when we talk about working with the body, you might remember the old idea of having a patient hit a pillow. If anything, that often makes things worse. But that's not what we're going to be talking about here. In fact, we'll tell you the key difference between effectively working with the body and just hitting a pillow. We'll also look at the types of movements that can help the body unlearn its adaptation to trauma. And finally, we'll get into the limbic system therapies, what it is, what they are, and how they can help us resolve trauma that's held in both the brain and the body. So let's get started with the basics. What exactly is happening in the body when someone is traumatized?
Our body is basically the signal of us that feels good, that doesn't feel good. And so life is lived out in the theater of the body. And so certain people we like to be with because our bodies feel good with them, and other people we don't like to be with, and it's because they give us the creeps. And so we live with the sensation in our body that tell us what's good and what's not good. When you are traumatized, abused, neglected, you start developing heartache and gut wrench. So it gets expressed somewhere in the midline of your body. That's where trauma is experienced. And so when you're dealing with hyper-aroused people so you're typically traumatized person, is that they're continuously plagued by gut-wrenching and heart-breaking sensations in their bodies. If as an adult you have these sensations, you try to do something to make it go away. You may take Prozac, or you may go to the gym, or you may get drunk, or you may have sex with a stranger, something to manage those bodily systems.
After trauma, our patients may be plagued by distressing sensations in their bodies. They may use all sorts of different coping strategies to try to numb these sensations. But that's for adults who've experienced trauma, abuse, or neglect. What about for kids?
When you're a kid and you're being abused, neglected, hounded by your own caregivers, you don't have an option of going to the psychopharmacologist, your drug dealer, or your local liquor store. And so you need to find ways of dealing with this overwhelming sensations in your body. And so anybody who works with traumatized kids, as school teachers, for example, they see these kids being unable to sit still. They're constantly hyper-aroused or shut down because their bodies give them the signal, I'm in danger and I'm not good. So if there's a chronic issue for kids, what they learn is to shut down their bodies. And it's interesting that people like our mutual friends, Peter Levine and Pat Ogden, have been talking about this for a long time. But it's astounding to what degree in psychology people think that trauma is expressed somewhere in the mind or in constructs. And really most clinicians are not aware to what degree, if you have a childhood trauma, abandonment, neglect history, you may not feel your pelvis. You may not feel danger signals. You may not feel panic. You may not feel like when somebody does something nasty, like I better get out of here and protect myself, because the bodily registration of goodness and badness tends to get very damaged. And people are not going to get better until they start having bodies that actually notice things.
So when a person's experienced trauma, they may lose touch with their body's ability to register what's good and bad. Their body might not sense danger in the same way that a healthy person's body would. This matters because it can hurt their ability to protect themselves from future trauma. How then can we help our clients begin to notice what's going on in their body?
So you work with somebody and somebody starts telling you a story, and I'll say, so where do you notice that? So the story is not so interesting. And what's interesting is what is being portrayed that's happening inside. So rather than saying, tell me more, I go like, so where do you notice in your body? And what comes up when you pay attention to that?
For Bessel, a key part of trauma work is to stay with the client's internal experience. Rather than putting the focus on their story, He asks clients to focus inward on their own body. So, how does he guide clients who aren't used to focusing inward in this way?
When people are reluctant to do so, I'll say, just maybe put your hand over here, and what it's like to think about it when you put your hand over here, and let's see what it's like for you to remember what it's like when your dad would get so drunk and so angry, and what happens in your body. What do you notice inside? And people oftentimes will start weeping or becoming very angry or upset, and I say, let's take a deep breath and notice what happens next and what comes up now. And so we really stay with the internal body experience at all times.
Our clients might naturally want to numb the painful sensations in their bodies, but instead, this approach puts the spotlight on those sensations. It can be painful and upsetting, but it can also be the first step in helping clients grow aware of what's happening in their bodies. It can begin to help a person retune that internal sense of good and bad that can get lost with trauma. Dr. Pat Ogden also focuses heavily on the body when she sees a client with a trauma history. It can be especially useful to take this approach when the client can't verbalize the trauma.
This is a real advantage for body psychotherapy because we do not need the words. A way to conceptualize that is that whatever happened in the past, your body holds the culmination of all those things. So when we learn to read the body and track its language, I call that the somatic narrative, the narrative of the body, which is telling a story. The verbal story is secondary to me to the somatic narrative because the body really speaks and can't be deceived by our minds. Like the client who said, I know I'm safe, but my body doesn't know that. So we look for the story that the body is telling. I've had so many clients who've had pre-verbal trauma. They don't remember what happened because their hippocampus isn't developed yet. But the body remembers. The body records everything.
Pat just mentioned the idea of the somatic narrative. That's the story that the body tells. Or another way to say it, it's what we can gain from looking at a person's body and its movements. It could mean posture, how a person walks, how they hold themselves. As you'll see in a few minutes, there's a lot we can learn both from the movements that a client makes as well as the movements that a client doesn't make. But let's stay with this idea of working with the body in the present. You see, for Pat, her focus is on how the client is feeling the effects of trauma in their body right now. To do this, you don't necessarily have to know the details of the past, but hearing the person's story can still be important.
The story is important to develop a rapport with the patient. Patients often need to tell their story to you, and they need to know that you can handle it, that you're not going to freak out along with them, you know, that you can hold it for them and that you can help them with it. And so they often need to tell it. But I don't need to know it because the effects of what happened is going to show up in everything that they say and do. They can be talking about the drive to work this morning, and you'll see their bodies respond in all kinds of different ways. And that's what's important. So we tend to use the body as an access route into the past, but not the content of the past, the effects of the past.
That's an important distinction that Pat just made. The body can be a window into how the past is affecting our client today, even though it doesn't tell us the details of the trauma story. It kind of reminds me a little of the story of the Stradivarius violin. Scientists and music lovers alike have done tests to try to analyze what gives these violins their famously expressive sound quality. A lot of people think that the key is the wood that was used to make them. Experts have made guesses about the history of the trees that the wood came from. They've talked about everything from a drought to a mini ice age. But the history of the wood isn't really the most important thing here. The key thing that matters is the way this history still lives in the present, how it changes the sound quality of the violin. Similarly, with Pat's approach, she is working with how past trauma affects the person's body right now. It's not so much about uncovering the story, although that does happen. It's more about focusing on the effect that can still be seen and observed in the present. Now, a moment ago, Pat gave a great example of why you might want to hear a client's trauma story. That's because it can help the client know that we can handle hearing their story and that we're there for them. But let's take that idea a step further. When else might telling the story be healing, and when might it often be counterproductive? Well, there's one key thing that can often make a difference.
It depends on how much secrecy there is. Like after a car accident or after 9/11, telling that story one more time is probably not all that helpful because we all know what happened. And there's no secrets and nobody's blaming anybody for anything. But if you grow up in a household where your loyalty towards your caregiver prevents you from telling the truth, being able to say what really happened back then and finds words for what this little kid was experiencing is incredibly powerful. How to give words to that experience does give you a sense of, yes, this happened to me, and gives you a sense of time. So I think, oftentimes my work gets misinterpreted. I don't believe that talking is useful. No, I think talking is everything and nothing. Same thing with the relationship. Relationship terribly important, and yet it's not the whole thing. No? So being able to say what happened. This is what happened to me. And I was that old, and that was what it was like for me. It's a fantastic thing. And so I very much believe in the liberating effects of language and finding words for secrets and forbidden experiences.
So when the trauma was a secret, it can be very healing for a person to speak the truth of what happened. That's especially true if the trauma was perpetrated by someone that the client trusted and had a relationship with. But if the facts of the trauma are already well known, like in the case of a car accident, then telling and retelling the story can begin to have the opposite effect.
At some point, oftentimes the story becomes an alibi. For many times, people, they tell the same story over and over again instead of feeling things very deeply. They go through a recital of misery, which is not the same thing as psychotherapy. It's going through a recital of misery, basically. It's different.
Instead of helping people tune into their emotions, retelling the story can almost become a way of tuning out. It doesn't necessarily help them make progress to tell it one more time. Beyond that, Bessel questions how effective it is to use only cognitive-based approaches when we're working with trauma.
So, yes, there's a definite room for language, but we don't know this because nobody's ever studied this and nobody can get money to study it. We don't know to what degree being able to put these deep internal experiences into words will change these brain patterns that get set by trauma. So do we get to see a change in the reaction of octal gray? Do people become less chronically prepared for danger? Are people able to filter out dangerous stimuli better? We don't know at this point. My hunch is not so much, or only to a limited degree. That's why I think that everybody who I know just about, except for what I call very simple trauma, namely a car accident or a rape in a healthy adult, very easy to treat with EMDR. But the early or long-term trauma requires a multimodal treatment, including real attention to the body and oftentimes neurofeedback to help to rewire those attentional systems.
Bessel makes an important distinction between single event and complex trauma. When it's a single traumatic event with a healthy adult, the treatment looks different than if the trauma happened to someone who's been traumatized before, particularly if a person grew up with poor attachment. If your client grew up with a long history of trauma, neglect, and unhealthy relationships, you most likely need to think about multiple approaches to address mind, body, and nervous system. So there's an important place for talk therapy, but it's probably not going to be enough. It's clearly also important to find out the body's story as well. Now, sometimes the two are in agreement. The body reinforces the verbal narrative. But there are also times when one story contradicts the other.
When people learn to track the body, they often hear a story that might add to the verbal narrative, or it might be saying something opposite. Like a client might be talking about their childhood and what a great childhood they had and how wonderful it was. But meantime, their body's tightening up like this, and they're saying, you know, my parents were great, they were wonderful, but you can see their bodies getting tighter, the body getting tighter and tighter. So you know there's a discrepancy there. That's a verbal narrative, but what's the body telling? Maybe it's saying, but I was abused, or I had to be tough, or they yelled at me. We don't know what the body's saying, but that's what we want to find out. Other times, the body corroborates the narrative, like a sexual abuse survivor talking about the abuse, and as she's talking, her body just starts to collapse and lose energy. And you can surmise that she probably went into some kind of collapse and shut down when the abuse was happening. So we track for the way the somatic narrative agrees with the story and the way that it's telling a different story.
As we just heard, the body's story can either corroborate or contradict what the person is telling us. So here's another way to think about what Pat's saying. It's as if we're reading a storybook. The body is like the illustration, while the details the client tells you are like the words on the page. So we need to ask ourselves, is the story congruent with the pictures, or is it out of sync with what we're seeing? Now, if you remember from a little earlier, one of the critical ways that the body tells its story is through posture. So what can we learn from looking at posture?
Well, the posture is the story, really, of the person's whole life. The posture, the facial expression, I consider that as part of the posture, and the autonomic activity. That is telling you where a person's life got stopped. And this is such valuable information. And this is something that I think probably most mental health professionals are not trained in. They're trained in mostly with the verbal discussion and verbal memory, explicit memory, rather than these postural shifts.
That's Dr. Peter Levine. He's a pioneer in working with the body to resolve trauma. And it's true. This isn't something many of us learned in grad school. So what kinds of things are we looking for when we think about posture? Now, when Peter talks about posture, it goes beyond the position of the spine. He's looking at the face as well, and any signs in the body that can reveal the state of a person's nervous system.
So it could be, for example, one shoulder higher than another. There could be a twist. More subtly, there could be a difference in the facial planes. One side of the face can actually be slightly higher than the other, or forward and back. You'll see the person holding a breath or hyperventilating. You'll notice color changes in the hands, in the face, and so forth. And this is giving you an autonomic window.
When Peter says autonomic window, he's talking about how we can get a reading on a client's nervous system. We can track how trauma is impacting the nervous system by looking at several things in particular. 1, the client's posture and movement. 2, their tone of voice and vocal patterns. 3, their breathing patterns. And 4, the coloring in their face and hands. These subtle, or at times not so subtle, cues from the body can give us a clearer picture of what's happening on the inside, particularly with their nervous system. And this matters because When the nervous system is stuck in a trauma response, it can be very difficult for a person to heal, despite the very best talk therapy. Now, let's get into the case that Dr. Pat Ogden mentioned at the beginning of this session. Pat had a client who would say things like,
I know I'm safe, but my body is just gone amok.
Now, this client was prone to dissociation and self-harm. She'd hurt herself or cut herself when she was angry. She even had tried to kill herself. So, how would you work with someone who's in that kind of place? Someone who cognitively knows she's safe, but her body doesn't seem to know it at all.
So the way I conceptualized it with this client was that all the sexual abuse she'd had as a child, she wanted to strike out and fight back. But if she did, she said the abuse would just get worse. Her father would torture her if she put up any fight at all. So when we see the impulse of anger in the body, we want to help that impulse be directed outward. And what's important there is that we're not working with getting angry at her father, because that didn't work back then, and that's not what's important. What we're really working with are the procedurally learned habits of response that are developed after trauma. So we're never really working with the memory. We're always working with the effects.
So we aim to work with the current pain, tension, or other trouble that trauma is causing in the body. Remember in session 3 when we talked about procedural memory? That's a way of describing how the trauma is manifesting itself in the present. So how does your client experience the effect of trauma in their body? Well, with Pat's client,
she felt the anger in her arm, and she felt that was what happened when she self-harmed. But as I helped her to stay with her body, she felt an impulse to go outward instead of inward. So for her, and for many traumatized patients, if not almost all, the act of triumph has to do with being able to protect yourself in some way so that the trauma doesn't happen to you.
Let's pause here a moment. Pat just mentioned the act of triumph. That's an idea that belongs to Pierre Janet. He was a contemporary of Sigmund Freud. An act of triumph is an empowering action, like fighting back or running away. It's physically protecting the client from trauma. Now let's get back to Pat's story and how that action played out for her client.
So for this client, making that motion was profound for her. Her whole body started to shift because we can imagine that action wanted to happen when she was a little girl being abused, but it was kind of stuck. And when it happened, she laughed, it brought joy, and it helped her experientially feel that protective action was possible now.
So making a protective motion was helpful for this client. Finding a physical way to express her needs was healing. Yet you've probably heard of patients back in the 60s who beat pillows and beat them to death. But it didn't seem to help. At the time, we thought that it would help people to release their anger and frustration and pent-up emotion. But it had almost the opposite effect in many cases. So what was missing there? How is Pat's approach different from what we did in the 60s?
What's missing there is mindfulness and awareness. In the 60s, when I was learning to be a psychotherapist, beating pillows with those batakas, do you remember? And people would they would lose all awareness, they would scream and beat these pillows. And to my way of thinking, that doesn't integrate the brain. A person is dissociating into just that part of themselves, which is not integrative. And they're playing out their subcortical impulses, but it's not integrated with the cortex. So mindfulness is very important because it does stimulate the frontal lobes and the cortex. So when this person was striking out and hitting out, she was reporting to me what she felt inside. She could access her thinking brain. It wasn't a dissociative, just emotional gesture.
That concept is absolutely critical. When we're working effectively with the body, it's bringing different parts of the brain together. It's not a time when the client cognitively checks out. When Pat was working with her client, the client was reporting back to Pat what she was feeling. Both her emotional brain and her thinking brain were online while she was making a protective action. This gets back to the idea of vertical integration that we talked about in the very first session. That's the key difference between what Pat's doing and the old idea of beating on pillows. In the one, the brain is integrated and fully online, while in the other, it can feel more like dissociation. Now, let's go back a bit deep and go a little deeper into how movement can be such a critical part of healing.
We are moving creatures. We have brains that the function of the brain is to move. Roger Sperry says in his 1981 Nobel Prize speech, he says, the brain is the organ that makes the muscles move. It has a few other secondary functions, but the most important function is to go move to get your mate and to get your food and to get your shelter. Yeah? So it's all about moving. And trauma is all about being unable to move and being helpless. So in order to become a capable person, you need to learn to move and to get what you need. And for that, you need to move your body.
Now, you'll remember that a key feature of trauma is that feeling of total paralysis. That could be part of why movement is key in reversing the effect of trauma. So now let's get back to Bessel van der Kolk and his thoughts on movement.
So oftentimes, when people are traumatized, certain movements have become associated unconsciously with danger or with failure. And so most traumatized people, and when you live in the world of sensory integration, you see that most traumatized people get very frozen in their bodies. Like, I should move because if I move, terrible things will happen to me. That's not up here in your brain. It's much deeper perception. And so in order to become a capable person, you need to actually move and learn that you can move your body in order to feel stuff. There's no shortcut. There's no shortcuts for this.
Certain gestures and movements can get connected with danger or failure. We're going to come back to that in a moment. But first, generally speaking, what types of movement are useful for our clients? What can change the pattern that the body learns during trauma?
It depends on the availability in your own community, depends who's around, it depends on your personal preferences. Some people love Qigong, like me. Some people like Tai Chi, not me. Very good for other people. Some people love yoga, I do. Some people love Peter Levine's work, I do. Some people love Ben Ogden's work, I do also. And it's about really opening up your awareness of your body movement, and how you can calm yourself down by moving and how you occupy space.
Bessel just gave us a lot of ideas there, but let's zero in on one for now, yoga. Now, a big part of yoga is moving with your breath. It helps you stay fully present in your body, which can be a challenge for trauma survivors. When you think about it, it has some major similarities, yoga does, with mindfulness meditation. However, when it comes to people with a history of trauma, mindfulness meditation can yield very different results.
We got into yoga, and eventually the first real study of yoga for PTSD, via trying to explore how we can calm down the brainstem and calm down it back of the brain. And we did discover that yoga does change heart rate variability and does change basically the organization of the brainstem. Meditation was always intriguing to me in that clearly meditation is very good to help you to come into your body and to notice what goes on with you. But I used to send my patients to John Kabat-Zinn's program down the street here in Worcester, and they would all flunk out. And why did you flunk out? Because for my traumatized people to sit still and to notice things was too overwhelming. And so if you don't have a container for your feelings, just sitting still can become very frightening, because that's where the trauma sits inside of you. and you spend all your time not trying to feel, and then when you sit still and you don't have any distractions, it starts coming up. But I think the advantage of yoga is it doesn't force you to think about yourself because you're working too hard to reach that toe or to stay in that position. So you still activate these interoceptive pathways, but it's more organized and it gives you a safe way of getting into yourself without opening up Pandora's box. Although Pandora's box gets opened even in the simplest yoga position sometimes if you're traumatized enough.
For someone who's experienced trauma, the stillness of meditation, as well as the space that it creates for introspection, might feel dangerous or triggering. Yoga can feel a lot safer for some clients. So, how effective is yoga for helping people who've experienced trauma?
I'm thinking about somebody who used to mutilate herself all the time. And again, was one of these people, like so many traumatized people, who try to dissociate from their body. And when they start feeling something, they cut themselves and do something or take drugs to make those feelings go away. And so, we have had 60 people enroll in our studies of yoga right now, and they know all of them. And I know that slowly by sitting in a chair, feeling their neck, safely feeling their bodies, being able to slowly start doing hip opening poses, very scary. They start owning that part of their bodies, and they don't need to run away from it. So slowly, as time goes on, they start having sensation in their bodies. They know through a yoga practice that sensations come and go, and so they are no longer scared of it, and they give up their self-mutilation practices because they know it's safe to feel the feelings in your body. Check it out. And so our yoga studies, we have done 3 of them now, 3 published studies now, show that yoga is more effective than any medication has ever been studied for PTSD. That has strangely enough resulted in psychopharm clinics being turned to yoga studios. I don't know why.
Through yoga, patients can very slowly reconnect with the parts of their body that may have seemed unsafe to feel and move after trauma. So this therapy is undoing the feeling of paralysis that can often accompany unresolved trauma. It's helping your patient experience for themselves how sensations can come and go. It's teaching them that their bodily sensations are tolerable because they're not permanent. They're not going to last forever. Now, a few minutes ago, we talked about how after trauma, certain gestures and movements can get connected with danger or failure. For example, Bessel talked about how yoga poses that open up the hips can be terrifying for some patients. So when we're thinking about movement, there's a lot we can learn both from the movements that a client does make, as well as the ones that feel impossible for them to make. This gets into what Pat Ogden calls a movement vocabulary. This is a person's repertoire of movements and gestures that they use to express themselves. So what kinds of things are we looking for?
When they greet you, do they lean forward and reach out to shake your hand, or do they pull away and look at you askance and maybe reach out very tentatively to shake your hand, or aggressively to shake your hand? So when we think of movement vocabulary, Pierre Genet would say, look at movements that are familiar for the client and movements that are unfamiliar. So if we look at reaching out, seeking proximity, if your client had a decent, good enough attachment relationship, they're probably going to be able to make connection with you, seek proximity, reach to you for help and advice, etc. But if a client didn't, they might be skeptical, that reaching out might be truncated or weak or aggressive, because those proximity-seeking actions are so much related with attachment, as John Bowlby would say.
Pat gave a few examples just now, like reaching out and seeking proximity, but there are many other actions to look for, like can your client grasp something that they want and can they hold on to it? Or beyond that, can they draw an object close to them? Pat had a client who struggled with one movement in particular.
there's something he really wanted, and there was an object that represented that something that I held for him. And I said, well, see if you can just reach out and take it. And he reached out and he grabbed it, but he could not pull it towards him. And he said, they're just going to take it away. So I'm not going to take that risk of being disappointed. So he couldn't really take what he wanted for himself. And so he lost a lot of pleasure and joy because that had been his experience. If I take something that really means something to me, it's going to get taken away.
So this movement that he couldn't make clearly had some deeper significance. Now that you have the basic idea, let's focus in a bit more. What movements are particularly relevant when we're talking about trauma?
The pushing motion, or the defensive motion is abandoned for many trauma survivors because it was overpowered, it wasn't successful. And wisely, we will abandon those actions that aren't successful. The problem of it is that our bodies don't catch up when the times have changed. And that, I feel like that's really why clients come to therapy, is because they're still rooted in the past, what Anno Vanderhart calls trauma time. They're still living in trauma time as if the danger is right here, right now, when it's not. So we see that in the body. We see it in reaching, grasping, pulling motions, defensive motions, and most very importantly, the ability to yield, or what Bonnie Bainbridge Cohen would call it yielding, to relax and let down. So many trauma survivors have trouble letting down and just yielding and resting and relaxing. So when we look at the somatic narrative, we're looking at that vocabulary of movement and actions that are easy and familiar and actions that are not. And we want to help clients expand their movement vocabulary. Because if you can't reach out to somebody, the richness of your life is diminished. If you can't pull towards you what you love or what you want, the richness of your life is diminished. If you can't hold on to something that you want and you want for yourself, it also diminishes the quality of your life.
When a client's movements are restricted, that can be an indicator of larger restrictions in their life as well. Let's consider a client who can't reach out. How exactly would you work with someone like that? Well, there was a client that Pat worked with who was a young man in a relationship. He loved his girlfriend and she wanted to get engaged, but he didn't feel comfortable with that and he didn't know why. After all, he really did want to be with her.
And as he talked about her, you could see this conflict in his body. Like he would talk about her and he would lean forward a little bit. Sometimes his hand would open up, but then he would also tighten up and pull back when he talked about her wanting to get married. So there was something in that somatic narrative that his body was telling us. So it was very simple to choose a proximity-seeking action of just reaching out. And I didn't connect it to his girlfriend or to me. I just said, well, what happens when you just reach out? And he said, this is really hard, was the first thing he said. And he had a difficulty even reaching. He's a very smart young man. And he said, there's something going on with this. And he would try to reach out, and then childhood memories would come about people wanting him to be independent, his parents wanting him to be independent. That was the message that he got. Not really welcoming his need or his desire for connection. They were very busy working people, and he got the message that he should just do it on his own. So it did connect with his childhood history. That was not paramount. What was paramount was what his body was doing with this reaching out. And then he realized, I'm doing the same thing with my girlfriend. Like, I'm afraid of marriage because I'm supposed to be independent. And if I really join with her, maybe that will damage my independence. So we just kept exploring that reaching out and working with all the roadblocks to it, all the beliefs and the way his body wanted to pull back, and just exploring it until he could comfortably reach out. And now that he's married and expecting his second child.
For Pat's client, working with movement unlocked deeper insights into his fears about marriage. But sometimes a client doesn't necessarily need to figure out something cognitively to begin healing. They need experiences that contradict the messages that they're getting from their body. The reason goes back to an idea that's come up again and again in this program. Trauma doesn't just impact the thinking brain. It can potentially impact every level of the brain, along with the nervous system and the body as well.
That's a metaphor I like to use, in that so much of trauma is in the limbic system, or what people used to call the limbic system. In that all these areas of the brain have to do with danger, safety, perception of the world get changed. So basically, most of the therapies that I'm advocating here is limbic system therapy. It's all about understanding or figuring things out, because that's not really where the trauma sits. Trauma sits in your automatic reactions and your dispositions and how you interpret the world. So in order to really rewire those automatic perceptions, you need to have deep experiences that for your survival brain contradicts how you are now disposed to think.
Bessel just mentioned the limbic system. Now, broadly speaking, that's the emotional part of the brain. It contains both the hippocampus and the amygdala. As we covered in session 1, the hippocampus is associated with memory, and the amygdala is involved in detecting threat. Now, you might have noticed that he said what people used to call the limbic system. That's because there's some question about whether or not it's still useful to think of all the parts of the brain that make up the limbic system as a unified system. However, what's important to take away here is this. Trauma doesn't necessarily live in the one part of the brain that's concerned with reason and insight. It inhabits the parts that shape our temperament and the way we understand the world and our automatic reactions. So when we target the part of the brain that's feeling and reacting to the lesson that part of the brain has learned from trauma, that can change the way a person with a trauma history is wired to respond. So what does it look like to have an experience like that, one that rewires the brain?
For example, if you grow up thinking that you're helpless and that anybody can do anything to you unless you yell at them, that becomes your disposition. But now, if you take a martial art course, you get to deeply feel like, wow, I can kick anybody in the groin at any time if I feel like it, and I can protect myself. And if you have experienced that, of becoming a martial artist, then that feeling of I'm always helpless will dramatically change. You cannot do that abstractly. So you need to have experiences that directly contradict how your body is disposed. Who understands this best is the US Army, who learned it from the Dutch Army, that learned it from the Roman Army over 2,000 years. And basic training, you march and you climb and you crawl through the mud, and every night you go to bed and say, oh my God, I'm amazing, I survived this. I thought I could never do this, but I can. And by the end of 12 weeks, these kids are transformed because they have experiences that run them to the max of new challenges. And we should have experiences like that in every mental health center. That is limbic system therapy.
So to change the way a client's body reacts after trauma, we need physical experiences that directly contradict what the body has learned. Now, there's a little more to this type of intervention. We're going to need to tease apart our neuroanatomy a bit further because the limbic parts of the brain don't function in isolation. They're connected to other parts of the brain as well.
I think when we think about intervening with the limbic system, we also need to think about the lower part of the brain, the midbrain, and specifically the periaqueductal gray, because I think the two brain regions really work in tandem. And so as we know from the work by Panksepp and others, the midbrain is responsible for all major emotional systems.
That's Dr. Ruth Lanius. She's professor of psychiatry and the director of the Post-Traumatic Stress Disorder Research Unit at the University of Western Ontario.
I think one can't be seen in isolation without the other, in my opinion. Some people would probably disagree with that. Also, it's the midbrain that's involved in the defensive responses, and I think when we talk about limbic system therapies, working with defensive responses, working with very basic emotional responses is very much part of these therapies. So I would call them a midbrain limbic system therapy.
The brain is deeply interconnected. It's hard to talk about any one part in isolation. So really, when you take a step back, it's about integration. But what does this mean for our work with our patients? Well, in trauma, the upper and lower parts of the brain can get disconnected. So when a client has emotional defensive responses, the upper part of the brain might be no longer in control. It's not regulating that person's responses.
The key question is, how can we help connect the lower brain structures with the upper brain structures that are involved in logic and awareness and helping us plan? And I think the midbrain limbic system therapies are a great way of really helping the brain reorganize from bottom up. And so the way this would work is if you reorganize the lower parts of the brain and they start firing differently, this affects all layers of the brain because they're all connected. And so as you're changing some of the basic defenses, right? If a person wasn't able to defend themselves and now they can defend themselves, this re-regulates all areas of the brain to the point where they now think, okay, I'm no longer helpless. I can defend myself. They can experience joy now because they can do that. So by working with the very low parts of the brain, we're actually reorganizing the whole brain.
So limbic system therapies are about creating an experience for your client, usually a physical one. That new experience is designed to override the lessons that the body and the nervous system learned during trauma. But it's not only about working with the lower and middle parts of the brain, because again, integration is key. It's about reorganizing the brain from the bottom up and reconnecting the higher and lower parts of the brain. Now that we have the concept of limbic and midbrain therapy, let's look at a case to see how to apply it with a specific client. Ruth had a client who worked in a jewelry store, and one day, a man walked in and he started chatting with her. What she didn't know was that later on, he was going to rob her, and this crime would leave a profound imprint on her nervous system.
So he went to the store 3 times before the robbery, really talked to the sales representative, shared his marital difficulties and, the difficulties with his children. So she actually had a relationship with this person. And then one day he came in, and then they again had a conversation, and all of a sudden he grabbed a piece of jewelry from her, harmed her, and ran out of the jewelry store.
In that moment, in the moment, because of her freeze response, this woman couldn't protect herself during the robbery. This made her afraid that she wouldn't be able to protect herself in the future.
Her biggest fear was that if she were to see him again, which she thought she would not be able to protect herself because of this freezing response. She also had no memory of his face, and so she thought she would be at further risk because she wouldn't recognize him.
So this woman couldn't remember the robber's face after the robbery, and this was a big part of her fear. To help this client, Ruth took a bottom-up approach and targeted the midbrain and limbic system. Let's see how she did that.
Because she froze, she wasn't able to engage in an active defensive response, right? So I got her to bring up the image of the robber, and she couldn't see the face yet, but she just brought up whatever she could while engaging in an active defensive response and saying no. And over time, what happened was that, she completed the action she couldn't complete at the time of the trauma, which was, defending herself. But as she completed that action, also what happened was that the face filled in for her. So she now was able to remember his face. And this was fascinating to me because at the same time we were studying these brain connections, and it's actually the midbrain periaqueductal gray that connects directly to the fusiform gyrus that helps us to recognize faces.
Let's pause here a moment. Ruth just mentioned the periaqueductal gray. Now, you'll remember from our first session that this is a very primitive part of the brain. It plays a big role in detecting danger, and it lights up when someone's experiencing trauma. Beyond that, Ruth just pointed out that the periaqueductal gray is connected to the part of the brain that helps us recognize faces.
So the two are directly connected. And so once she was able to complete that active defensive response and his face come online, she now no longer had the fear that she could not protect herself if she were to see him again. And as it happened, 3 weeks later, after we had done this piece of work, she actually saw him in the parking lot. And she didn't have an anxiety response. She felt very calm, and she, felt a real sense of mastery because, she had done the work and she was no longer triggered by him. And so she felt very pleased about that. But I think that's the form of treatment where you really work with, lower regions of the brain, helping to engage in these defensive responses, completing the action that the person wasn't able to complete at the time of the trauma, and that reorganized her entire brain. She now had a feeling of safety. She felt reconnected with her body. Her sense of self had changed. So you've really organized the brain, I think, from a bottom-up approach and really affected all parts of the brain.
Completing the defensive action rewired this client's brain from the bottom up. When we can integrate the brain from the bottom up, there are lots of positive outcomes. It can help them feel more safe. It can help them reconnect with their body, and it can even change their sense of self. But real quick, if you like what you've heard so far, or if there's anything that you want to hear again so that you can reabsorb it, so that you can apply it to your work, let me just invite you to sign up for a gold subscription. With a gold subscription, you'll get the video and the audio downloads from every session, as well as the transcripts. So that's for the whole series, including the session on what's going on in the brain when someone experiences trauma, the session on the neurobiology of attachment, the session on how to work with traumatic memory that's embedded in the nervous system, the session on how to help clients tolerate dysregulation and come back from hypoarousal, and this session that you're watching right now on how to work with the limbic system. Your gold subscription is also what makes it possible for us to continue this work and to fulfill our mission to make this program available for free to practitioners throughout the world. But here's the thing. This is the last session of the program, and so the price is going to be going up very soon. You'll be able to get it later, but you'll pay more for it. So in order to get the lowest price possible, I want to encourage you to buy it now before the price goes up. For some of our clients, they can get stuck in the past, replaying the same traumatic loop over and over, like it's happening now. In a moment, Bill O'Hanlon is going to share a technique for helping clients change the way they remember trauma in order to move forward. Then Joan Borisenko will get into an exercise that can help clients integrate the brain and bring a person's thinking brain back online.
I think they get stuck in a lot of, or potentially get stuck in a lot of ways. And I think neurologically and physiologically, we really focused on this week. And those are probably the fastest or most powerful ways to unstick people and get them moving and not frozen in time. But I think the next level down is perceptual patterns. And most of my clients, when they've been through a trauma, they'll have some repetitive loop of perception. Like I had a client who was raped in a parking lot, and her head was pushed down against some asphalt. And every time after that, she would smell asphalt and get fearful and nauseated. And it was that little loop of perception that would keep going through. And so I think if you can change perception patterns, you can sort of get people out of those grooves of the repetitive memory of the trauma, stuck in that moment kind of stuff. And so the NLP people have a bunch of techniques for this they call submodalities. They have people watch the movie of their trauma backwards, or change it from color to black and white, or they have them imagine that people in it have taken helium and have Mickey Mouse voices. So any small change in any of the submodalities, especially where you're frozen, if it's a smell modality, you could smell cinnamon instead of asphalt, somehow bring something new. The body has a memory of that if you've ever smelled cinnamon or something like that. If you've ever seen a movie go backwards, you can recreate that in some way. So evoking some shift in the perception, because when people remember the trauma, they almost always remember the same moment in the same way, from the same angle, or the same voice or sound. It's usually in one of the sensory systems. So if you can mess around with that and give people, again, that flexibility and get them ungrooved, they may be able to move on.
Thanks. So, Joan, we've looked at how incorporating mindfulness and awareness into a physical action can help to integrate the brain. When you're working with the body, what are some ways to help activate the thinking brain?
Well, one of them is definitely the narration of what's going on in your body, which certainly Pat talked to. So suddenly, not only are you noticing what's in your body, but you're reporting on it. And one of the people who's been doing that for 35 years is actually not a therapist, but he's a teacher of something called the Diamond Approach. He writes under the name of A.H. Almos, but his actual name is Hamid Ali. And central to his to his system of just waking up and being more present is just that, to do what he calls a body-based inquiry. And my husband is a longtime student of Hamid's. And so my husband Gordon and I will often do this together, and that is we'll sit together, do a kind of inner search of what's going on, first one person in their body, and then report it to the other. This is what's happening. There's a tightness over here. There's a holding over here. There's an expansiveness in here. And in both hearing yourself and in reporting to another, you're definitely recruiting different circuits. And that's a very, very easy thing, I think, for people to learn to do with a friend or with a spouse, is this reporting out. And so you get what's going on in the right brain into the left brain, and you make some integration like that.
I want to remind you, this was the final session of the Treating Trauma Master Series, and the price is going to be going up soon. So in order to have your own links to all of the videos, all of the audios, all of the transcripts, and all of the learning tools, I encourage you to buy a gold subscription now. We began working on this project 2 years ago, and originally we designed it as a program that would only be available to people who bought it. But once we completed our work on it, we realized how helpful that it could be to people all over the world. So we made it our mission to make this program available free of charge to practitioners everywhere. So if you can, please support us by signing up for a gold subscription. But right now, please go to the comment board and tell us how you're going to use these ideas in your work with your clients. And remember, every time we help someone heal from trauma, we change the course of civilization. That's because when healing occurs, not only is that one life changed, but also the lives of that person's family, their friends, and possibly even their community. Once people have experienced that gift, you've opened up the potential for new hopes and dreams that they might never have imagined possible. And so they're changed forever. So thank you, everyone. The